Disseminated intravascular coagulation, DIC. Well, what is it? Well, first let's look at the name, disseminated. That means it's all over. It is not focused in one spot in the body, it's all throughout the body. Intravascular, it is occurring throughout the vasculature, staying inside the blood vessels. It's all over the body, and we start with a coagulation problem. It is uncontrolled clotting, followed by massive hemorrhage. With DIC, some sort of inflammatory process has triggered the clotting factors. They're activated. So we see uncontrolled thrombi formation. Maybe they're little tiny things, maybe they're larger, but the bottom line is there's a depletion of the clotting factors, so we have massive hemorrhage. What kicked off the inflammatic process? Well, generally we're looking at epithelial damage. Severe tissue injury, such as trauma, burns, head injury, may kick it off. Recent surgery. Sepsis, an overwhelming infection in the blood. Some cancers will trigger it. Some pregnancy complications, such as a retained placenta after the delivery of the baby. Shock might do it, and a blood transfusion reaction might do it. This disease has two specific stages. In the beginning, the body is forming lots and lots of clots. Maybe they are very small ones that cause very minimal damage. Maybe they're getting larger and causing very severe damage. But if these clots lodge in the central nervous system, we might see headaches, weakness, or it may get to the point of having seizures and coma. Blood clotting in the renal system shows up as poor urine output and maybe even renal failure. And if we're looking at larger clots, we may end up with a pulmonary emboli or a myocardial infarction, the clot landing somewhere in the coronary arteries. So in this case, we may see cough, shortness of breath, respiratory distress, and chest pain. Once the body has used up all the clotting factors, the body has been using them and haven't had time to make more factors, then we're going to the hemorrhage stage. It tends to be sudden and extensive. Clotting factors are all over the body. We don't have them. We don't have them anywhere in the body. So it's bleeding from everywhere. We see bruising. We see petechiae. We see epistaxis. Bleeding, maybe from multiple sites in the body. And because we're losing volume, we're getting a drop in the blood pressure. We treat the cause, and we need to make a decision. Are we in the clotting stage? Are we in the hemorrhaging stage? Quite often we treat it with heparin, but the treatment is tailored to where are we in the disease process. And then fluid management.